Hello, everyone. Today I'm just going to make a short video to talk to you about patellofemoral pain and specifically patella maltracking. And I'll go into a little detail about that, but before I kind of go into the anatomy of it and some of the problems that we see here, I want to tell you a bit of my own story, which gives a bit of context about why I'm so interested in this problem. And at 18 years old, I had a problem with my left knee from playing too much football and being a bit too heavy, and it was related to my kneecap, and there was a lot of wear and tear on the back of my left kneecap, and there was two cracks, according to the doctor from my memory, in the cartilage on the back of my kneecap, and that was causing a lot of pain. So much so that I remember doing a first aid course, and I was the youngest person, one of the youngest people in the first aid course, one of the youngest. And I had to ask politely for a cushion for my knee because it hurt too much to kneel, whereas there was heaps of people way older than me and way less, mobile than me and who didn't need that much of a problem. But yeah, the pain was getting too bad. And I'd see the specialist. The specialist had to, he's just doing an operation. And I did the operation and it really solved the problem, for good. And it was that conversation with the specialist that prompted me to explore my career options, to get me to this stage where I'm doing now. And just from simply him saying to me that this could have been prevented by a better muscle balance. So that kind of straight away clicked in my mind, curiosity, figuring out what does it mean? It could be prevented. What kind of exercises, or what should I have done? What could I keep doing to try to maximize my knee health? And yeah, I think I've carried that through. And at the moment, actually, I'm suffering some pain in my right knee from a similar kind of pain, but also so many clients here complain about knee problems. And I think there's a very, very clear trend towards the kneecap being a primary factor in the pain that people experience. And a lot of times, people have had knee replacements and the pain is still lingering, or a pain is still lingering, or they're having constantly problems, and the doctors keep telling them that it's arthritis and you need a knee replacement and there's nothing you can do, and it's just wear and tear and that kind of stuff. Where really, when we do assess people, we find that the kneecap tracking is a major factor in their pain. A lot of times, if we tape the kneecap in the right spot, or if we do some exercises that alleviate that kneecap tracking problem, we find that the pain is resolved, and that can be the difference for people without having to go through a major surgery or just suffer for unnecessary periods of time. So what I'll do now is I'll go through some of the anatomy with you to explain that a little bit more in more detail. So I'll just share my anatomy little model thing. All right. So this is the kneecap that we're predominantly talking about here today. And the biggest issue with the kneecap is that it doesn't actually connect physically with another piece of bone. It just kind of hovers in the middle of space here, right? So that means that it's very vulnerable to poor positioning because it's not actually fixed in its position with a series of joints. So the way that this kneecap's position, maybe before that, we should understand that this area of the femur here is the articular surface. So it's the area where movement and friction should stay, right? So the kneecap, if you bend your knee, this articular surface that's colored green right now will become more exposed, and we want the kneecap to smoothly track on that area of smooth cartilage. And what happened to me, and what happens to a lot of people, is that that's not happening. So the kneecap starts to drift a bit too far to the rough part of the bone, and it might just take a series, one or two events, or a series of events where the kneecap hits the outside edge of this smooth area and hits the rough part of the bone, and that damage can be, permanent, really, and very painful. And that's what happened to me. So my kneecap had two cracks in it because, over time or in a series of events, the kneecap hit the rough part of the bone a bit too forcefully and created some cracks in the back of the cartilage. So that's usually the bad side, is that if the kneecap is not in the right spot, then it's going to hit the rough part of the bone, and that can cause a lot of pain and problems ongoing. So the X-rays can be part of the identification for this, but also I think we can see it with a bit of trial and error inside the clinic with a few exercises that can really expose kneecap tracking problems, and also trialing, correcting the kneecap position with tape or with a brace or with exercises, and then reassessing the painful movements. We can usually find that if the pain is resolved, then we know that the kneecap was tracking incorrectly, and that was the primary cause of the pain. So anyway, so the back of the kneecap here, this is the cartilage of Patella. It needs to align with the smooth part of the femur, and as long as they stay aligned, then you're going to be all right. And if they continue to misalign and create friction, and then there can be damage on this back of the kneecap area, and that damage can lead to you might need surgery, or you just might suffer ongoing pain. Sometimes people will describe like catching in the knee, like especially the kneecap, and a lot of times people will mostly suffer this phenomenon when they're like going down the stairs. Is one of the primary things, because there's a lot of load on your quadricep muscle, and if it's not tracking in the right spot, that can create friction, which I'll go through in a second. So yeah, the pain down the stairs, kind of like random bouts of pain where arthritis is a bit more consistent pain, and like sometimes people say, oh, my knee really hurts today, or I was going for a walk and my knee really hurt while I was doing an activity or doing walking. I think the other thing is kneeling. People struggle with kneeling, and that's usually as well related to kneecap kind of maltracking issues. So I want to explain the reasons why this, the pull of the kneecap is influenced by two main muscles, kind of against each other, right? So the biggest problem that we have is when the kneecap tracks to the outside. So most of the time, I think, I would say over 90% of the time, that maybe more than that, maybe 99% of the time that I've seen at least, the kneecap is drifting to the outside of the knee. So there's a few reasons that can happen, but really that's what we often see, and that's what we're worried about, is the kneecap tracking too far to the outside. So the reason for that, and my model here is not perfect, but it'll give us a good illustration. So the pull to the outside, so to the lateral side of your knee, is influenced by this structure here called IT band, so illiotibial tract, but it's IT band, right? ITB, and the IT band is a kind of long tendon, or really you could think of it as a ligament, but it's really a long tendon that extends from the TFL, tensor fasciale, and the glute medius tendon as well. So, but the muscles are up here. These are the parts that are contracting and relaxing. This is where the muscle is, and then the tendon is what's connecting that muscle to the kneecap on the outside. And what we see with this is that this structure is always pulling, so it's always tightening, because it's not muscle, it's a ligament or a tendon, and it's kind of always got a consistent pull upwards and to the outside. So the only way that our kneecap can stay kind of in position against the pull of this band is if we are very strong in its opposing muscle, which is this one called VMO, vastus medialis obliquus, and it's also one of the quadricep muscles. So it's the innermost layer, like the inside, the medial part of the quadricep. So quadricep is 4 muscles, right? So these are 3, and there's one more, which is way underneath here. Sorry. All right. So these 4 muscles are called quadriceps, and the innermost muscle is the one that we're talking about here, and that's the one that keeps the kneecap in the right position, usually to the inside. And what we see is that most people have problems with their kneecap tracking, and as I did when I was 18, because this muscle wasn't doing its job well enough. So if it's not strong, or it's not switching on correctly, or it doesn't have enough endurance, so it might be able to work, for a certain number of reps, but not enough for what you need in your life, then it will start to give up. It will start to lose its control over the kneecap, and then the kneecap will start drifting to the outside, because the IT band is so dominant and so tight always, because it's not a muscle. So So basically the pull of these two structures is what's going to determine mostly where the kneecap sits. So in our treatment, a lot of times it's just working on this muscle here, VMO, and there's specific exercises that we have to target, you know, in that muscle and that muscle strength, which I can cover in a different video. But that's ultimately what we need to come back to, you know, is that this muscle developing. You know, we can also work on stretching the IT band. And again, I'll cover that in a separate video. And if that gets a bit more, you know, lax in it, then it will reduce how much it's pulling on the IT band. And there are, you know, I've had one client who had a knee replacement, and she needed to have a lateral release later because the kneecap was not working correctly, even after the knee replacement. And the lateral release is basically where they cut a bit of this IT band to create a little bit more room. So, you know, that can be something that if we can't actually stretch it out or create that lax in the muscle, it might require surgery, or surgery could be an option to accelerate, you know, how quickly things can get better. But really, I think that the lay person's kind of stretching routine is things like foam rolling the IT band, which can be quite painful. But even like just using a massage tool, or there's certain stretches that you can do as well that get that muscle to stretch, that tendon to stretch. So that's one factor, and yeah, improving VMO is another factor. I think the last thing I want to discuss about the kneecap tracking that we see a lot, and you know, there's a bit of overlap from what I've just said, but also it can be its own problem, and sometimes it's actually a genetic issue as well, which is when the kneecap sits too high in the groove here, and that's called patella alta, and that means that the kneecap is too high up. And that's as a result, usually, of the quadriceps being too tight. So if this muscle group here is too tight, so it doesn't have as much length in it, so it's super narrow, then the kneecap is always being pulled upwards. And that can create a lot of issues and a lot of pain as well. A bit different to what I've said before, in that the kneecap will hit the top part of the femur here. Like, so rather than the outside, which is probably the most common, patella alta, the kneecap hits the top part, and that's usually again when you know, when you're kneeling, or when you're trying to bend your knee, like doing a squat, or doing going down the stairs or stairs, right? So, but again, that's a bit less common. I think that's a bit more like the genetic part is, we see it a bit more in young adolescents who are growing, like especially you know, people who have a growth spurt all of a sudden and the muscle hasn't quite adjusted. But yeah, it can also be a factor for you know, people with kind of chronic knee problems, that as the quadricep muscle starts to, you know, weaken or you know, work improperly, then that can create, yeah, the upward lift of the kneecap, which can cause some excess friction, right? So I think that's the explanation of the anatomy and the background of a lot of, you know, what we see contributes to knee pain. And I think, you know, it's pretty simple. I feel like it's pretty simple because I've kind of suffered through it, and I've seen it. It's always on my mind. But I think a lot of people, and even specialists and doctors, they underestimate how much pain and discomfort and inconvenience can stem from the kneecap not tracking in the right spot. And I think there's not enough usually done early on in a treatment attempt to address the kneecap position. I think a lot of times, you know, people will go to have knee replacements, or you know, use like big braces and that kind of stuff to support the knee joint, or even just avoid activities, like they'll avoid the stairs, or avoid walking, or avoid exercising because of the pain, where really a lot of times it can be improved and resolved quite simply with some attention to improving VMO strength and endurance, and, you know, releasing IT band tightness and flexibility, and also, you know, simple home strategies like taping, using specific braces that target the kneecap tracking, stretching as well, the quadriceps muscle, like I mentioned, to try to reduce how much the upward force is, and even like other suggestions like using ice. You know, once it does hit a rough part of the bone, once there is that sudden jolt against something that's not smooth, there can be some inflammation, and that inflammation can also create some discomfort and pain and pressure in the area. So, you know, ice can also be a part of a remedy. But again, what I would suggest for you is you get a bit more of a personalized assessment And you know, that's what we love to do, but you know, getting an idea of what is actually wrong with your knee, not just assuming it's arthritis, or not just assuming, you know, that it's something that you can't fix yourself, that just, you know, it's just a matter of time before, you know, you need to have surgery or something. I think I would challenge you to get a proper assessment, have someone investigate the tracking of your knee, and even yourself, you can just attempt to correct the position of the kneecap, or do the exercises that I'll suggest, and then see if that reduces your pain. And if it does, then you have a better feeling that that's part of the problem. Thanks for watching. I really hope that you get something valuable from this. And if you have any questions, please ask in the comments, or just ask me. And I really hope that you know, your knee can get better soon. Bye.